Why does a walking child slowly loses his ability to walk? Let's see about an important condition affecting the muscles, and it is called as Duchenne muscular dystrophy. Duchenne muscular dystrophy, commonly called as DMD. This is a disease which mostly affects the males. It is inherited and it inherits by a pattern called as X-linked recessive disorder. That is, mostly the females are carriers and the males get affected by this disease. This disease occurs and the patient exhibits the following symptoms. Major symptoms are that the patient cannot walk properly. They are progressively losing their capacity to walk. They exhibit that they are very weak and they cannot perform more activities. They tend to fall frequently and it will be their major complaint. The patient exhibit a major symptom called as the Gover's sign, that is climbing upon one's body. When we ask the patient to get up from the floor or get up from a chair, they tend to give support with their own hands on their body to get up because their proximal muscles are so weak that they cannot perform this activity independently. The another symptom which becomes more clear that this is Duchenne muscular dystrophy is that the pseudo hypertrophy of muscle. Hypertrophy is when your muscles become big than as usual, but pseudo hypertrophy is this is not real muscles, and the real muscles are broken down since there is no proper dystrophin protein and they are replaced by the fatty tissues. In this Duchenne muscular dystrophy conditions, the dystrophin protein is lost. Because of this, the muscles undergo constant breakdown and the patient tends to lose their capacity to walk independently. There are stages in these conditions, that is, the Duchenne muscular dystrophy is classified into 5 stages. The first stage is pre-symptomatic stage. During this stage, the patient exhibits no symptoms, but still we can diagnose if the patient has a previous family history of Duchenne muscular dystrophy. Their blood test indicates that they have increased creatinine phosphate level. The stage 2 is early ambulatory stage. During this stage, the patient walks, but still they may have clumsiness in their walking. The stage 2 is the late ambulatory stage. Even during this stage, the patient walks, but they tend to fall more and they tend to avoid walking more. This stage, people can sometimes use some orthotic devices for their support, and up to 11 years, the child may be in the second stage of Duchenne muscular dystrophy. The third stage is early non-ambulatory stage. That is, the disease progresses and the child tend to be in their one place and tends to use assistive devices such as wheelchair for mobility. But they can self-propel the wheelchair, but still their ambulation is a question mark. The last stage is late non-ambulatory stage. During this stage, the patient may be by the age of 19 to 20 or 20 to 25 years old, and they may suffer from serious other complications such as respiratory muscle weakness, and most of the people unfortunately die by this last non-ambulatory stage. We physios cannot stop the progression of the disease or stop the course of the disease, but still we can do management which helps in managing their symptoms. We can manage their weakness, we can provide endurance training, we can provide supportive mobility aids, we can provide psychological counseling, and we can give them a purpose to live so that we can educate people and understand that not every disease needs cure. Sometimes we need to live within the time which we have. Thank you. Bye.